topic is about how flexibility affects strength gains with resistance training. So a quick introduction would be, so flexibility has like a big impact on your normal day lifestyle. So like getting dressed and getting out of the car, flexibility plays a big role in that. And so having improved flexibility can help your development of strength, speed, and power. It reduces your likelihood of injury. It helps your posture, and it helps relieve stress. And so resistance training can be described as the proportionality between strength gains, the load, frequency, and intensity applied to that. These are just some basic principles. So putting the two together, so being able to move your joints through their full range of motion can help you get like the max amount of gains from your resistance training workout, which then helps develop strength gains quicker and more efficiently.
An article by Cole C. Rubin and his colleagues examined and reviewed studies in strength and flexibility. These articles were obtained through databases. The main focus of this study was to examine several different study journals. One of them was on the acute effects of stretching and strength performance. Most studies of these showed that there was a decrease in strength performance when preceded by stretching. In a study that looked at jumping performance showed that PNF stretching decreased performance, while static showed no significant decrease. For chronic effects of stretching and strength performance, evidence suggested that although stretching exercise may have a negative acute effect on strength, this may not be the case after chronic stretching. So we see strength gains seem to occur after 3 weeks of flexibility training. For adaptation mechanisms, findings show that stretching is capable for promoting increase in muscle strength or hypertrophy. Nevertheless, the experimental conditions of these studies were very different than the conditions normally recommended and applied to humans, because many of these studies used animal subjects. In these two tables, we have the data that was obtained from these studies. So on this section, we have the references, the type of stretch, the duration of the stretch, the muscle stretched, the muscle tested, the total duration, and the type of action, and the results. So in the results section, we could see either a decrease or no decrease, no change, an increase in the percent of muscle activity produced from each muscle. The study concluded that training for flexibility and strength is highly recommended for those who want to achieve good fitness and good health. And there appears to be substantial evidence suggesting the decrease in strength following stretching, but evidence suggests that although stretching exercise may have a negative acute effect on strength, this may not be the case for a chronic or long-term stretching. So if you're trying to increase your strength gains, it is widely recommended to do them and to follow a training program in which stretching is long-term, not just before a certain exercise, because that obviously would hinder your abilities to perform the exercise.
To continue our presentation of how flexibility increased strength and resistance training, I'd like to present this article that was published in 2013 by the author named Bunquist, showing how the range of motion of heavy squat loading affects the muscle and tendon adaptations. The purpose of the study was to see the differences between a short and a long range of motion of a barbell back squat. So Bunquist randomly selected 17 male students, about mid-20s, with similar height and weight. So there was 2 different types of squat, the shallow and deep squat. 8 of them did the deep squat and 9 of them did the shallow squat. We could see in the images that the deep squat is on the right side and the left side of the shallow squat. So the shallow squat did a 0 to 60 degrees of knee flexion, and the deep squat did 0 to 120 of knee flexion. And 0 degrees means that the leg is fully extended. So they did about 12 weeks of experiment that each group did the exact same reps and exact same maximal sets as well. So after the 12 weeks, they came up with these results. So keep in mind that both groups did the 1RM test for both the shout and deep squat. So for the deep squat group, with the 8 males, they got both of them 3% increase on both the deep and the shallow squat. For the shallow squat, when they did the 1RM, 4% increase when they did the shallow squat, but when they did the deep squat, there was only 2% increase. And we could see that in the right side of the graph in this slide. And also, that deep squat training did increase the cross-sectional area of both of the front thigh muscles, and also increase the lean body mass. But there is no effects on the patellar tendon. So Bungus just concluded that the deep squat training was much superior than the shallow squat. And as we look back at the previous slide, there we could see that the shallow squat represents someone who has lack of flexibility in the hips. Even though that in the shallow squat and in the graph, in the picture, that you can see there's much of a heavier load. But the reason why a shallow squat could do more load because the moment arm is less than the deep squat. The moment arm is represented by the axial rotation by the knee joint. So not lifting more weight does not necessarily means we get more effect. It's properly how you do the exercise, how do you get the benefit of the exercise, which in this article, the deep squat is the best way to go. So someone who, like I said before, with someone who lack of flexibility would most likely would not do the full range of motion, which is affecting their straight gains.
In 2011, a study was conducted to verify strength and flexibility gains after switching up exercise routines. A sample size of 80 untrained women were tested for a total of 16 weeks. The sample size was divided into 4 groups. The first group consisted of strength training, the second group consisted of flexibility, third group flexibility and strength training, and the fourth group the control group. The control group basically had individuals that did not perform any exercises and only were allowed to do activities of daily living. Strength was assessed by using the bench press and leg press machine, while the flexibility was assessed doing the sit and reach test. Strength training routine consisted of eight exercises for a total of 3 sets each. Repetitions gradually increased from 8 to 15 reps. The flexibility routine consisted of static stretching in the lower body, shoulders, hips, and trunks. Static stretching was performed for at least 15 seconds and gradually increased to 60 seconds. The results of this study showed increases in almost all the groups. The group with the most increase in gains was the strength training group. The strength training group showed a 71% increase in the machine leg press and 200% in the bench press machine, while the strength training and flexibility group showed an increase of 57% in the leg press and 150% in the bench press machine. However, the group that consisted of the flexibility training showed a very small amount of increase in strength gains. Only a 7.7% in leg press machine and a 0% increase in the bench press machine. So basically, this study is very helpful for people who are trying to get strength gains when it comes to either the bench press or squat or leg press machine. I will recommend a person to incorporate both strength training and flexibility in their routine, and not just flexibility training. As the results show in this study, if you just perform flexibility training, you won't really see much strength gains.
So our topic talked about how flexibility affects strength gains, but my article kind of talks about it in reverse, so how strength gains increases flexibility. So the article discussed an experiment conducted focusing on sedentary women who either focus only on resistance training or flexibility training, and then a group that did both together. And they found that alone, strength does increase your flexibility, but strength and flexibility training put together increases it to a greater extent. So in the past, past, it's been perceived that strength training does not affect your flexibility. However, this experiment shows that it does have an effect. But further research is being conducted to find which specific strength training exercises can enhance your total body range of motion and optimal flexibility. And then this graph is not associated with the article, but it is just a simple graph that kind of shows how like your strength, balance, and flexibility should increase like equally with each other, so one directly affects the other. So this means that if one aspect wasn't improving as much or as quickly as the rest of them, then it would affect the entire training program. So if your flexibility wasn't increasing, it would be harder for your strength gains to increase as well.
The title of the article I researched and found is Resistance Training versus Static Stretching Effects on Flexibility and Strength, and this was a study conducted at the University of North Dakota in Grand Forks. And the purpose of the study was to determine how full range resistance training affected flexibility and strength compared to static stretching of the same muscle joint complexes in untrained adults. And there were 25 volunteers randomized for a resistance training or static stretching training group. And then there was a group of inactive volunteers, 12, served as a convenience control group. And after pre-testing hamstring extension, hip flexion and extension, shoulder extension flexibility, and peak torque of quadriceps and hamstring muscles, subjects completed a 5-week static stretching or resistant training treatments in which the aim was to stretch or to strength train the same muscle joint complexes over similar movement and ranges. Post-tests of flexibility and strength were then conducted, and then there were no differences in hamstring flexibility, hip flexion, and hip extension improvement between resistance training and static stretching, but both were superior in the control group values. There were no differences between groups on shoulder extension flexibility, and the resistance training group was superior to the control group in knee extension peak torque, but there is no differences between groups on knee flexion peak torque. And the results of this preliminary study suggest that carefully constructed full range resistant training regimens can improve flexibility, as well as the typical static stretching regimens employed in conditioning programs. And because of potential practical significance of these results to strength and conditioning programs, further studies using true experimental designs, larger sample sizes, and longer training durations should be conducted with the aim of confirming or disproving these results. So in other words, there's not enough stuff there in order for us to really make a definite decision on whether or not strength training and flexibility have a positive or negative correlation.